Hello everyone and welcome back to my channel. Myself Dr. Drsurabhisahney, the host and the founder of the channel Dr. Drsurabhisahney Dental Series and Medical Video. Today I'm gonna talk about another important topic of the subject of journal surgery, which you read in third year of dentistry as well as in MBBS. So without wasting time, let's get started. Another name of cellulitis is phlegmon, and the question arises, what is cellulitis? So here is the definition of cellulitis. First of all, you need to understand it thoroughly, that it is the diffuse inflammation of the dermal and the subcutaneous layer of the skin. It is defined as the severe inflammation of the dermal and the subcutaneous layer of the skin. It also includes the formation of the pus. If we talk about the causative agent or the causative microorganism, then the Streptococcus is the causative organism for this condition. Basically, Streptococcus release two things. One is the hyaluronidase and second one is the streptokinase. This will give rise to the net result, and that is the inflammation of the particular area which is affected, and that is result in the gross swallowing of that particular area, followed by the other signs and symptoms of inflammation. Remember one thing, whenever there is a loose connective tissue or the loose subcutaneous tissue, the infection rate is increased. That means the spread of infection is very fast. For example, in case of face, forearm or scrotum. If we talk about the predisposing factor, then there are two main predisposing factors. The first one is the diabetes and the second one is the low resistance of an individual. If we talk about the cause of the cellulitis, then there are three main causes. The first one is some kind of a scratch, second snake bite or scorpion bite, and the third one is the injury, which could be major injury or the minor injury. If we talk about the site of infection, then the common site is the scrotum, face and the lower limbs. If we talk about the incidence and prevalence of cellulitis, although the incidence of cellulitis is found to be unknown because there are several cases which are seldom reported. However, it is found that it is most commonly affected in the face area of the children as well as in the adults which are above the age of 50 years. Let's talk about the clinical feature of cellulitis. In case of the clinical feature of the cellulitis, it will definitely show the gross swelling of that particular area which is affected with severe inflammation, followed by the signs and symptoms of inflammation, that is pain, fever and toxemia. The differential diagnosis could be the abscess. How you can differentiate clinically the difference between cellulitis and abscess. So there is one mnemonic which I have prepared to make the differentiate between these two. That is NO ELPF. E stand for edge. In case of edge, if we talk about cellulitis and the abscess, in case of cellulitis there is no edge, and in case of abscess definitely there is the presence of the edge because it is well circumscribed. Second thing is F, that is fluctuation. In cellulitis there is no fluctuation, but in case of abscess the fluctuation is positive. Third one is the L, and that stands for limit. If we talk about the limit, there is no limit in case of cellulitis again, and in case of abscess, limit is present. Last one is the P, and that is stand for pus. There is no pus in case of cellulitis, but definitely there is the presence of the pus in case of abscess. So this is mnemonic will help you to make a clinically differentiate between cellulitis and the abscess. Of untreated cases and the severe cases, it results in the gangrene and the excessive suppuration. Begin with the treatment of the cellulitis. If we talk about the treatment, so the first treatment is the bed rest with the elevation of the leg, because that will help in the reduction of the edema of the legs. The second treatment is, if the patient is diabetic, then you need to treat it with the help of insulin, which has to be given subcutaneously. The third treatment is the antibiotics. You need to administer the antibiotics. So the main antibiotic is the injection of penicillin of 10 lakh. You can give the intramuscularly or intravenously for next 5 to 7 days. That too with the difference of 6 hours. Along with that, you can also give the other antibiotic like ciprofloxacin 500 mg twice a day. Dressing of MgSO4 along with glycerin to that particular affected area, so as to reduce the chances and there is the reduction of the edema. With the last part of the topic, that is the complications of the cellulitis. So the first complication and the most common complication is that the cellulitis has the capability to change into the abscess. So transformation from cellulitis to an abscess is the first complication and the most common complication. Second complication is the necrotizing fasciitis. In this, because most commonly the face is the main area which is involved, and when there is definitely the severe form of inflammation, that can lead to the total inflammation in the subcutaneous tissue of the facial plane, that can lead to the condition of necrotizing fasciitis. Begin with the third complication, and that is the toxemia and septicemia. There is one syndrome that is associated with cellulitis, and that is the streptococcal toxic shock syndrome. That might also happen if the organism release some exotoxin. Last complication is, if the patient is diabetic, then there might be the chances of the occurrence of ketoacidosis. So that's all about the treatment, clinical feature, and all about the cellulitis. If you haven't subscribed to my channel, then please subscribe to my channel by pressing the button subscribe, and don't forget to press the bell icon. The importance of bell icon is that you can have the notification of my upcoming videos. If you like this video, press the like button and comment down. If you have any query, you can drop me a mail which is shown on your screen. You can also follow me on the Instagram, and my Instagram ID is shown on the screen. Do share more and more my videos. Thank you for watching.